A sudden breakout of white spots on your back may be disconcerting, and it can be one of a number of things. White spots are especially visible against dark skin, whether in dark-skinned people or on tan skins. These white spots can either be caused by infections or depigmentation of the skin. Unless these spots itch and fester, they are most likely either a skin fungal infection or vitiligo. This skin condition is the most common causes of white spots on the skin. They often appear on the back and shoulders, and sometimes they are found on the face and the limbs. It is called tinea versicolor. What is tinea versicolor? Tinea versicolor is a yeast infection. It is also known as tinea flava, pityriasis versicolor, and dermatomycosis furfuracea. It is caused by the fungus Malassezia globosa. However, in a few cases, it can also be caused by a related fungus, Malassezia furfur. These fungi are normally found on the skin, but under the right conditions, they may cause white spots to appear on the body. Tinea versicolor presents as white rashes mostly on the trunk, but also on the face and limbs. It is believed that warm and humid conditions promote the appearance of these spots. Therefore, it is most common during the summer months. However, there are reports of people developing this form of white rash after repeated sessions on tanning beds. Even then, the exact initiation and progression of the fungal growth and the appearance of the white spots are still unknown. Tinea versicolor is a common skin condition. It affects 2–8% of the population, and it is especially found on adolescents and young adults. This preference is believed to be because of the increased sebum production during the teenage years. The causative fungi of tinea versicolor thrive on the lipids found in sebum and the dead skin cells produced in high amounts in adolescence. Therefore, they are usually associated with other skin conditions such as dandruff and seborrheic dermatitis. Some symptoms of tinea versicolor. Tinea versicolor starts out as oval spots measuring less than 1 inch in diameter. These spots can appear whitish, dark tan or pink in color, and they soon grow bigger and merge to form patches. These spots have sharp borders, and when closely examined, they may produce faint, flaking scales on the skin. When the skin temperature is raised, the white spots of tinea versicolor become darker and may itch severely. However, once the skin starts sweating from the high temperature, the itching stops. Under the microscope, the yeasts causing tinea versicolor appear as round structures with filaments. This has given them the popular connotation, spaghetti and meatballs. Tinea versicolor causes hypopigmentation in dark-skinned people, but hyperpigmentation is its more common presentation in light-skinned people. Therefore, if you are dark-skinned or have a tan, the white spots on your back can either be tinea versicolor or hypopigmentation skin disorders such as vitiligo. However, if you are light-skinned, any white spots would most likely be vitiligo. Treatments for tinea versicolor. There are different medications for treating tinea versicolor depending on its severity. Topical antifungal agents. These are the most common drugs for treating tinea versicolor. Tinoderm is a topical solution containing tolnaftate. It can be mixed with bathing water, and its effect lasts a long time. Therefore, it is recommended to be used at night. Of topical antifungal agents, selenium sulfide is the most commonly used agent for treating the white spots of this skin condition. It is available in 2 strengths, 1% selenium sulfide in non-prescription topical products such as Sunspot medicated cream and Selsun Blue shampoo, and 2.5% selenium sulfide in prescription products such as Selsun Extra Strength shampoo. Other common topical antifungal agents prescribed include ketoconazole, clotrimazole, and cyclopirox. Oral antifungal agents. These are prescription drugs. They include ketoconazole, fluconazole, and itraconazole. These drugs can be taken normally, but to increase their efficacies, patients are asked to work out and sweat 1 to 2 hours after taking the drug. This is because these drugs are eliminated from the body through sweat. Therefore, when sweat evaporates, the residual drugs are left on the skin, where they can produce their topical effect by working directly on the skin. To make this work, patients are asked to delay taking their baths for a day after the dose. Natural remedies. A few herbal extracts have demonstrated clinical effectiveness in different studies. The two most important natural remedies for treating tinea versicolor are tea tree oil and senna elata. If you enjoyed this video, please like, share and subscribe.